Hello and welcome back to GP Video Podcast by Nadia. So, as you guys know that I'm very passionate about making these video podcasts so I can express my views about different medical topics and also relay all the information that I have to wider community, because I might see 30 to 40 patients a day, but still I've got that eagerness to be able to convey my messages, convey my thoughts to a lot more people and try and benefit more and more people as I can. So what I've decided is alongside doing the topics that I'm covering, every day whatever I learn or whatever the key points are from every patient of mine, I would be sharing them with you as well. So today's number one key point from my first patient was, she had basically come in to me. There are other stuff as well, but her latest complaint was her dizziness, and then we went through her bloods again and saw that her cholesterol was high. So I started her on cholesterol tablet, and after 2 months of doing cholesterol tablets, her dizziness is completely gone. Though I was checking her heart, brain, and all the let's say eyes, ears, ENT, brain, heart, all of that, I had already started checking all of them. Her Holter monitor was normal, her ECG was normal. But then she came back to me after a month, not 2 months, after a month actually, just for a checkup. Her dizziness is completely gone after starting the cholesterol tablet. So the first key take-home key point from my first patient is high cholesterol can also cause dizziness. Number two is that because I'm the only doctor in my practice these days, so I have to see patients of other GPs as well. And the patient had come to me for a repeat blood pressure script, and I asked him to do another BP with me because I'm usually not comfortable giving repeat scripts, especially for the blood pressure, until and unless I don't check the blood pressure. Checking blood pressure and weight for every patient of mine is mandatory. So when you walk in my clinic, the first thing I do is, after asking permission of course, is do a blood pressure and a weight, until and unless the patient doesn't want to do it. So he was also a bit reluctant because he was in a bit of hurry. So I gave him the script today, but the takeaway point is, please, whenever you go to even another GP for a repeat script of blood pressure, please get your blood pressure checked always, because I know some people have white collar syndrome, some people might feel anxious and all, but it's always a good idea to keep a tab on your blood pressure, and there is no harm in it. I mean, there might be high readings, usually there can be false positive as well, but then you will be more vigilant about taking your tablets, and then be more vigilant about following up with your own GP for doing your regular blood pressures. Okay, then I had another patient whose blood tests were reviewed. He's my regular patient, and you wouldn't believe, but fatty liver was completely reversed with weight loss. So as I have told you, that fatty liver has got 4 to 5 important causes, which is the metabolic syndrome that I was talking to you about yesterday, in which the parent is obesity and the siblings or the offsprings are high cholesterol, high sugars, or insulin resistance, and number 3 is high blood pressure. So basically fatty livers, high blood pressure cannot be much related, but again, because it's a metabolic syndrome, and then high blood pressure is also caused to be somehow related to fatty liver. Anyways, this particular guy had two things. He didn't have high cholesterol, he does have high BP. He is not an alcoholic, so alcohol is one of the other causes for fatty liver, and he does not, despite having like morbid obesity, his BMI is around 40, but he didn't have high cholesterol, which is, again, as I said, not all the 4 factors have to be positive in one person. There could be 1, there could be 2, there could be 3 to 4. But anyways, his risk factors with the fatty liver were his obesity, with the abdominal obesity basically, which is what is regarded for metabolic syndrome or for fatty liver as well. So he was obese with a BMI of 40, and he had high blood pressure. Plus, he had high insulin resistance. So his cells have become resistant to insulin, therefore his sugars are not being consumed. So just with the weight loss with Wegovy of around 10 kgs, he's actually completely reversed his mild fatty liver. So as I said that fatty liver is a completely reversible disease, that is very, very true. And then another take-home message is that high sugar food can also be converted to high cholesterol. So what the high sugar does is, especially the refined sugar, sucrose and fructose and all, what it does is it actually increases the bad cholesterol in the body and decreases the good cholesterol. What is the mechanism? I will talk to you about it some other time, but you should just know that sugars, like in, let's say in the normal terms, we should know that sugars can be converted to cholesterol. That's all. So not only high cholesterol food, high saturated fatty foods can cause high cholesterol, high sugary foods can also cause high cholesterol. So yeah, that is the take home message. Anyways, then we had I had another girl who's my regular patient. We just did her normal bloods, and like she's got a BMI of like 20 and she's a very healthy eater and everything, and we did bloods for some other reason, but what I found was high cholesterol, high total cholesterol, marginally high but still high. If you remember, we spoke about familial hypercholesterolemia the other day, in which the condition is inherited and kids have high cholesterol from age of 5, and but the hallmark of familial hypercholesterolemia is that it has high LDL. But this particular girl did have high total cholesterol, did have high triglycerides, but didn't have high LDL. So this also can be one of the genetic forms of high cholesterol, though not familial hypercholesterolemia. So yes, for now, because it's only marginally high, we have just, though she has got a perfectly healthy lifestyle, exercise, diet, everything is good, but I've still asked her to just look into her food, see if she's eating high sugary foods, maybe resort to a dietitian and see if we can control it with the more healthier eating and more physical exercise. If not, and if the number keeps on creeping up, then we might have to look into doing statins at some stage. But this is what I explained to her, that most probably it's a genetic condition for you as well. And because her mother is also my patient, and she's also very slim and smart with a healthy lifestyle, but she also has high cholesterol. So now, yeah, I can connect the dots. So yeah, these were all till now. I've only seen I started 11 a.m. and it's 12:39 p.m. I've only seen 9 patients by now. So I will come back to you guys with more insight, and then the normal video podcasts with normal topics. See you soon.